Welcome to the LL Corpus Cogere Incorporated presentation of Bridging the Gap in Physical Therapy Equipment. This video is intended to showcase our innovative new age physical therapy equipment for use by patients in physical rehabilitation. Physical therapy is a healthcare profession primarily concerned with the remediation of impairments and disabilities and the promotion of mobility, functional ability, quality of life, and movement potential through examination, evaluation, diagnosis, and hands-on intervention carried out by physical therapists. The first historical documented account of physical therapy is from the Old Master of Medicines, Hippocrates, in 460 BC. The key treatment equipment used at that time was human hands manipulation. Over the years, physical therapy has been successfully practiced chiefly in hospitals and supported by an array of medical and therapeutic equipment since the early 1900s until the early 1950s. In the late 1950s, physical therapists started to practice exodus from traditional hospital settings to newly established subacute rehabilitation facilities, outpatient PT clinics, skilled nursing homes, and patient homes. At that time, PT-centric equipment started to appear to support disabled patients recovering from disabling conditions. Presently, physical therapists treat patients with an array of specialized equipment to treat back pain, osteoarthritis, Alzheimer's disease, Parkinson's disease, bursitis, muscle strains, Guillain-Barré syndrome, balance conditions, asthma, fibromyalgia, wounds, burns, rheumatoid arthritis, and a host of other conditions in all types of healthcare facilities and in patients' homes. Candidates for rehabilitation are individuals with neurological disorders, orthopedic dysfunction and surgeries, systemic conditions, and victims of trauma to the brain and spinal cord. Population may be pediatric to geriatric and works well with bariatric patients. Disabled patients requiring prolonged post-hospital rehabilitation therapy currently face the unenviable situation of being unable to establish a successful in-home environment conducive to physical therapy exercises. This condition largely results from premature discharge from a medical facility, unprepared domestic setting for continuance of therapy, unavailability of in-home PT and/or caregiver assistance, and lack of government and/or commercial insurance for payment of extended physical therapy. Use of physical therapy equipment in the current environment presents healthcare industry and patients with critical pain points that impact the availability, use, and expense of PT treatment. Key pain points include requirement for multi-therapist support for most PT sessions. Large and expensive PT equipment limits use to healthcare facilities as opposed to in-home use. Limitations of parallel bars for use with severely disabled patients. Lack of focus on gait programs for wheelchair-bound patients.
My name is Louise Lontoc, and I am the founder and executive vice president of the LL Corpus Cogere. The LL Corpus team is excited about the innovative new age PT equipment that we will be offering to the marketplace.
With the LL Corpus equipment, there is now the vista for patients and PTs to jointly construct an in-home therapy program that supports an evidence-based rehabilitation outcomes as required by Medicare and medical insurance providers. The LL Corpus approach for treating neurological and orthopedic disorders is the provision of our in-home gait equipment. This new age type of equipment assists disabled patients to safely continue therapeutic activities in-home with similar outcomes to parallel bar sessions, typically only available in medical facilities and clinics. Without disruption in their medically required and supported therapeutic exercises, patients are able to achieve their personal goals and functional outcome.
The equipment is focused on patients who live alone without accessibility of family or caregivers to assist them in standing or rising from a sitting position. With ever-increasing healthcare costs, the equipment makes it possible for patients to continue therapeutic exercises without interruption for optimal benefits of a professional medical-supported rehabilitative weight-bearing program with maximum safety so as to avoid falls resulting in further medical complications.
Hi, my name is Mary Lepoulier. I'm a physical therapist in CHT. I'm the owner of Active Sports Rehab. We have 3 practice locations in California, Tustin, Corner Park, and in Norwalk. As a physical therapist, I want to protect my back, and with in-home gait equipment, there's no lifting required. Patients feel secure and harnessed while standing, and their fear of falling is less, and my hands are free to help guide them through their exercises. I highly recommend in-home gait equipment, and it can be installed in any doorway.
Hello, my name is Alexa Crosby. I'm a physical therapist and have been practicing for over 20 years. The in-home gait equipment system is truly revolutionary in that it encourages early functional weight-bearing activities in patients upon discharge from a hospital or a rehab facility. This ensures a smooth transition of care, and with a vital signs monitoring feature, you are assured of patient safety and full compliance with the treatment program. Its ease of setup and use not only provides safety and effective rehab to patients, but it also prevents therapists from injuries related to heavy lifting and repetitive activities.
Hello, my name is Rose Frangi. I'm a physical therapist for 20 years in the state of California. During my career, I have witnessed the lack of safe, useful, and cost-effective rehab equipment, both in clinic and in-home use. Also, I've witnessed the lack of or difficulty of providing weight-bearing or loading exercises to clients that require the help and assistance of multiple PTs or caregivers. What if there was a physical device that actually allows you to be an effective therapist and that is not cost prohibitive to the ordinary person? I'm excited to tell you that Corpus Cogere has developed new age and state-of-the-art equipment to provide solutions to these problems. The Corpus Cogere is the brainchild of Louise Lantok. She's a physical therapist who shares the same passion, dedication, and frustration that we experience in our healthcare industry. One of the devices is an in-home gait device apparatus that is mobile and is safe and is cost-effective and delivers and provides effective outcomes for the patients and the families as well. I believe that this in-home gait device will provide a whole new world of opportunity for us physical therapists, and again, optimally for the patients themselves, in order for them to achieve their highest practicable level of function.
The fundamental goal of the in-home gait equipment is to help disabled patients regain movement of limbs with weight-bearing exercises. The equipment enables patients to safely lift and support themselves using their upper body strength within the Corpus New Age body harness, while actively performing customized therapy programs developed by registered PTs. In summary, Corpus's user-friendly and comfort-designed equipment encourages patient proactive usage, which definitely supports positive wellness results. Thank you for listening and watching the Corpus Cogere video. It has been a pleasure to share our excitement and passion for physical therapy and introduction of our new age PT equipment and solutions. Please feel free to contact us with questions or requests for additional information on our company and products. The Corpus team is dedicated to immediately respond to all requests from existing customers and soon-to-be customers.